Cardio-oncology is a blend of oncology and cardiology, and how it relates to our patients is it takes a very focused look at the potential side effects of our medications and how it could affect the cardiovascular system.
We know that the two diseases, cancer and cardiovascular disease, coexist in many patients. And the field really developed because we realized that a lot of the therapies that were being used to treat cancer patients can actually be toxic to the heart.
When a patient presents to us, we screen them to see if they have any of the risk factors or if they have a disease which requires treatment that might have heart implications. And when we do see these patients, we then reach out to a nurse navigator and they then coordinate an appointment for our patient to be seen in the cardio-oncology clinic.
My role as the nurse navigator is to be kind of that center person who I watch the patients, identify the patients as they come into the oncology practice. And once I identify them, then determine what kind of cardiac surveillance for those that we need. We do a lot of patient teaching, and we work with the physicians and do a lot of answering of questions because we are housed within the cancer center.
My navigation role is that when my patient starts a new medication and the pharmacist calls and lets me know, and I cover like the oral therapies, and so I'll go down and I'll meet the patient and I'll explain to them what kind of tests that they may be having done, like an EKG, an echo. A cancer patient can't wait for 3 months to see a cardiologist or wait for a couple weeks to get an echo before they can start their treatment. They need those things right away. So that's one thing that the program has allowed is for a timely response.
So the nurse navigator is the vital role for our program. And ultimately, it's living in the oncology world. It's our navigators, Holly and Carrie, who both have cardiovascular backgrounds, who spend day in and day out with our oncologists and bringing awareness and identifying those patients that can benefit and making sure that the patients don't get lost in a large health system.
So when I walk in, we do blood pressure, temperature, take vital statistics, weight monitoring. We review any side effects, even if I think they're small, anything that's happening that's different from the last time that I came in to visit. After that, I meet with the doctor and we go over similar questions just so he has a better understanding of what's happening.
The key players, it always starts with the patient, right? So the patient is probably the most important player in this entire process. I think the cardio-oncology program really does a terrific job of allaying those fears, making sure the patients realize that we are all here for them, we're a shoulder to lean on, that we're going to allow them to get through their cancer care with the best possible outcomes, both from the cancer care but also from cardiovascular issues.
And then he basically reviews my last test results, whether it's a scan or blood work, just to explain, here's where we were, here's where we are now, here's what I want to do to move you to the next phase of treatment.
There was a lot of collaboration to get the cardio-oncology program growing up for Franciscan Health. It had a lot to do with the backing of administration. We have to make sure that we have the schedules, the nurse support, the administrative support to make this program whole.
I think we have been very successful. I do think there's more work needs to be done. As every program grows, we identify more things that can be better, so we're working on it every day to make it better. But we have been very successful.
I think the innovation has given, once again, an awareness about what this is. There's a lot of community programs that are attempting to model what we have at Franciscan. There's so much opportunity, and I think this innovation, this award is recognition for that.
The best way to look at this is I'm in a fight. I'm fighting for my life. I fight every day. The physicians, the nurses, all the people that work in Franciscan Health are helping me combat the physical deterioration. I know that they want to see me progress and get better and still maintain function. And knowing that helps to make the whole fight easier.